All right, so in this training, we are going to go through treatment of the plantar fascia, the ability for the plantar fascia to move and separate away from cuneiforms here, okay? The rationale with that is that as the body progresses over the foot, the cuneiforms need the ability to splay and absorb that weight like a spring. But if the plantar fascia is basically just like saran wrapped up into these cuneiforms, they don't have anywhere to splay. Okay, so we're going to teach you how to get the mobility of the plantar fascia, not the plantar fascia to lengthen, but just to get it to move on the cuneiforms. All right, so that's the first technique. The second is how to actually localize and mobilize these cuneiforms if they are not splaying. So the medial cuneiform here needs the ability to splay inferior and medial. So it's kind of on this diagonal. The middle cuneiform needs the ability to go in just purely inferiorly. And the lateral cuneiform needs the ability to splay inferior and lateral. So it truly is kind of this splaying motion. All right, so that's the cuneiforms. Also, with the cuboid needs the ability to move top down. Wow, that's a really mobile cuboid. So it needs the ability to move top down, but it also, if we flip this over, needs the ability to move bottom up, right? So we would call this motion that it needs to be able to relatively plantar flex, versus this motion it needs to relatively be able to dorsiflex. Okay, so that's the cuboid. Now, with people, I want to give a little fun fact on the cuboid. I don't know if it's a fact, but this is how I think about it. With the cuboid, if you have a foot that is either truly pronated or compensated supinated, which is truly actually when you connect the hind foot a supinated foot, oftentimes this cuboid needs some ability to be mobilized into relative dorsiflexion here, okay? Whereas if the foot is truly fixed in a supinated position and it's stuck here, it's stuck in plantar flexion, it needs to be mobilized from the bottom. Okay, so whether you think about it as plantar flexion, dorsiflexion, we can get in the weeds about like how to actually name that. But essentially, if someone is stuck in compensated supination or pronation, we need to mobilize, oftentimes check and see if there's a hard infield from the top. If they're stuck in a supinated position, then we need to mobilize likely from the bottom. Okay, now that's cuboid. Moving on to the first ray here. Oftentimes with the first ray, if these cuneiforms are stuck, oftentimes this first ray will present in this position and in this position, which is what we call a bunion multiplied over time, okay? So the proximal portion or the base of that first ray gets compressed onto the second ray, and we want to, in order to restore more of a neutrality or neutral position, we want the first ray to go from here to here, straight on. In order to do that, we need to decompress the base of it here, okay? And then we also need to decompress the medial portion of this joint, doing some soft tissue work here, but then also working on the joint by blocking the bottom and pulling it into the opposite direction of where it wants to sit. It's kind of hard to see on that model, but essentially we're taking this kind of mechanism and decompressing proximal first ray and then opening up the medial portion of this joint to try and get this entire first ray to sit more straight, so that ultimately as the body progresses, we get cuneiforms that splay, we get weight that actually comes over the first ray and to where people are actually effectively able to push off of their big toe. If they can't do that, they'll either push off kind of their medial portion of that MTP, or they'll just get to a certain point and then just push off laterally. Okay, so that's kind of the overview of what we're doing from cuneiform, cuboid, first ray. Depending on time, we might get into some of the other 4 digits here as well.